Coronavirus has left the world isolated in their homes, leaving government officials to issue a stay-at-home order where people are not allowed to leave their homes unless they need food, medical care, or if they're an essential worker. It has caused for non-essential businesses to close, leaving millions of people in the United States without jobs, many who are undocumented. As most of the unemployed population await their unemployment benefits and their promised part of the $2 trillion stimulus plan, undocumented immigrants are overlooked and excluded from government-funded relief bills. The unprecedented coronavirus pandemic has left immigrants questioning if they will be able to pay their bills or where their next meal is coming from. There are no official resources designed for those who are specifically undocumented, but luckily they have created resources to help people regardless of immigration status. Resource guides were for those in need of food to organizations like Care and Share Food Bank and Food Bank of the Rockies, who help keep Colorado families fed by offering donations of food throughout Colorado. Unfortunately, the lack of financial stability is not the only concern. Another concern that is impacting immigrant communities is the fear of seeking medical attention, not feeling safe getting tested or treated because of fear of the U.S. Immigration and Customs Enforcement. In late February, the federal government put into effect the public charge rule, which tightly limits non-citizens' use of government programs. This rule has left many immigrants increasingly afraid to seek any public service. They believe seeking help could lead to deportation. In early March, U.S. Citizenship and Immigration Service officials announced that the public charge rule would not apply to those who seek tests or treatment for the coronavirus. Many physicians fear news of the decision is not getting out. ICE classifies medical facilities as sensitive locations, and according to a recent statement, they do not conduct enforcement operations at medical facilities, except under extraordinary circumstances. Claims to the contrary are false and create unnecessary fear in communities. ICE has also reported that they are suspending all immigration arrests during the pandemic. The virus is affecting everyone one way or another, but of actual sickness and death, it is afflicting people of color, primarily those who live in the most populated areas of our cities, where it is easier for the virus to spread. Data from Florida, Michigan, and Louisiana show people in communities of color are being infected and dying at a far higher rate than white individuals. In New York, Black and Latino individuals are dying at rates twice that. Health officials attribute the disparities to high rates of underlying health conditions, lack of health insurance, and poverty in working-class immigrant communities. Advocates want the immigrant community to know they should not hesitate to seek medical help if needed. To find more information about resources or have any questions, visit www.informedimmigrant.com/guides/coronavirus. In this time of uncertainty, the public health officials and healthcare providers want you to know that you are safe and should seek medical attention if needed.